Hi, I'm Jay Tyler. Let's say you have a patient who came in for a rapid palatal expander and you fit bands on the molars, took the bands off, put them in the impression, poured the impression, and then after the model's set up, you looked at it and one of the bands was misplaced. So what do? Do you get the patient back in and try it again? Well, I'm going to show you a technique that you can use right in your in-office lab to fix this situation and reposition those bands. Here's a model we got for an RPE appliance. Came with the bands already in place, and this band looks pretty good. The doctor's got it formed to the tooth, and it looks like it's placed just where it's supposed to be. But over here, if we look at this band, you can see where the band was seated. They took the impression with the band in place, then took the bands off, put them in the impression, poured it, but this one got out of whack. It's too far gingival. Here's the band, here's where it's supposed to be. Put a little mark right there. See, if we look over on the mesial side, it's kind of all broken off, but you can tell it's down too far. It would probably be right about here. So that's where the band needs to be. Now if you look on the distal buccal, you can see that it's just a little bit too far in to the tooth. See if I can get a good shot of that. So the band comes like it's too far in this way. Just a little bit, not bad, but just a little bit. So we're going to replace this band, and what we're going to do is duplicate the model. In fact, I've already duplicated the model. All I did was mix up some alginate, put it in a tray, put it over this model after soaking it, separated it, and poured it up, and I've got this. So this is a nice replication of what we just saw, and you can tell right here where the band needs to be. It needs to go right across there. So I'm going to put a mark right there. Now this band is in good shape, so we'll just put it back where where that is. Now I'm going to take a burr and go around and cut this out, and then I'm going to take these bands off, and I'm going to take the plaster out. I'll grind that out, and then we'll pick it up from there. Alright, so here's the original model, and all I did was I took a lab knife and I just stuck under there and just popped them off. And so I just placed them back in here, and then I took this little burr right here and went inside and kind of ground out the plaster and chipped it out. Now this is the same burr I used to go around the molars. This little burr just kind of circumnavigated the molar and knocked the plaster away, and leaving the detail of where the bands were. And so you can see my pencil mark where I want to go there. Now, this band goes on this tooth. All I do is I set it down on top of the tooth, line it up the way it was, and then I take a nice sharp barred Parker and I go down and just cut straight down. This is going to be for an RPE. If you don't know how to make an RPE, go to our website, ortholabvideos.com. I've got a video on all kinds of expanders. Alright, now I take my lab knife and just kind of dress it up a little bit. And let's see, okay, it's starting to go down. I'm going to take a little more off. Okay, I'm just going to shave a little bit. Just a little bit. I want to leave that band on there, especially on the occlusal. Like cut half of it off and leave the other half so I can tell where it went. Okay, I need a little bit more. I'm going to just kind of scrape it. You just keep working with it until you can get it down. but I'd rather just take off a little at a time and leave my marks where I can tell where it was. Okay, there we go. So now you can tell that's where it was before. Goes down nice and neatly, and you can actually see where the impression of where the band was around there. So we've got that nice and even with that. Okay, now let's come over on this side. This is the one that didn't fit. We can put that right down on top, just like we did before. We'll line it up and start cutting the excess plaster away. Take this off and scrape a little bit off. Okay, you're going to have to take a little more off. It's not just real easy, but it's a whole lot easier than getting the patient back in, taking a new impression. You just have to take your time. So I'm just kind of cutting that band in half, thickness-wise. So I can slide this on. See, I'm still not able to go down. Scrape some more out. All right, now it's starting to go down. It's still not there. Okay. Looks like it's coming down on the buckle, but not on the lingual. So I'm going to cut some more of this lingual out here. Oh, there we go. That's it. Now, you can see my line that I drew. I'm going to put that band right even with that line, and make sure it's right even with where it was before on the buckle. And so there we have the bands lined up the way they should be, and we can go ahead and make our rapid palatal expansion appliance without having to get the patient back in. That's always a good thing. All right, that's it. We'll see you next week.